Okay, so good morning. Welcome to those that have already joined us for our second day of the Healthy Aging and Fall Prevention Virtual Summit. We are here today talking about medication management and side effects. We have our expert here with us, Jared Cortopassi. He is a pharmacist with Sutter Health, so we are really happy to have him here with us today. So we have many things going on throughout the week. So if you weren't able to join us yesterday on Zoom for diabetes, heart health, and stroke, you can still watch that session on our website. And then again, throughout the week, we'll be having different sessions happening upcoming Wednesday, Thursday, and Friday. So we hope to see you in those sessions as the week goes on. So again, as I mentioned, today we'll be discussing medication management and side effects. So we're really excited to share these topics with you. I do want to mention that this video is being recorded. So if you want to turn your video off at this time, you can do that. This recording will be posted on our website and social media at the end of the session. And again, participants will remain muted until our question and answer section. This event would not be possible without some of our awesome sponsors. So thank you to our presenting sponsors, Kaiser Permanente and Stanislaus County Area Agency on Aging. We also have some other great sponsors who have helped make this event possible. So thank you to all of those sponsors who have helped do that. And then again, along with our virtual component of this event, we have our drive-through distributions to get our event bags, which are surrounding me here. So if you live in the Modesto area, that distribution is coming up tomorrow. If you live in Grayson, it's also on Wednesday. Oakdale and Riverbank will be on Thursday, and then Ceres is happening on Friday. So if you live in any of those or live near any of those cities or towns, you can head over to those distribution locations and pick up your Summit tote bag with all the resources and goodies from our event sponsors. So we hope to see you at those drive-through events coming up throughout the week. And then, as I mentioned today, so we will be posting this on our website, www.healthyagingassociation.org, at the end of this video. Again, you can put questions into the chat box, and we will read those to our expert when it comes to the question and answer time. So please feel free to do that at any time. I do also want to mention that we have some resources up on the event webpage to help you understand what we'll be talking a little bit about and things to reference back to if you have any questions. So we do have this little fact sheet up on our website, medications linked to falls. And I know our speaker, Jared, will go into this a little bit more in depth. So I'm not going to cover it too much, but I want to let you know that the CDC handout is on our website to let you reference back to instructions on how to take your medications, what it should and should not be taken with, and potentials for interactions. I also just want to mention briefly some side effects that may be on your medications or are things to look out for. We do want to remind you to keep your medications up to date and get refills as needed. And then some side effects that you might see on your medications: dizziness, sedation, confusion, dry mouth, drowsiness, just to name a few. So those are things to look for as you review your medications. Remember to look at the side effects. And so at this time, I'm going to hand it over to our speaker, Jared Cortopassi. Again, he is a pharmacist with Sutter Health, and he's going to discuss with us how medications can contribute to falls and some strategies that we can use to prevent and keep some side effects under control. So, Jared, I'll hand it on over to you.
Perfect. Thank you very much, Jessica. Can you guys hear me?
Yes.
Okay. So I'm just going to give you some clinical pearls, which is kind of code in the pharmacy realm as useful pieces of information. Since there's thousands of medications and I don't really know which specific medications you or I guess this audience is on, I'm just going to kind of give a global strategy for this. So I will start off with, my name is Jared, and I am a clinical pharmacist for Sutter Memorial in Los Banos. I've been a pharmacist for about 6 years or so, and I do enjoy the job quite a bit because I do get opportunities to kind of engage with my, I guess, with people that could use my services, and I am able to provide genuine help in instances like this. So to start things off, I'm pretty sure it's kind of known, but as we age, our bodies get a little bit slower in the healing process. A broken bone may be a mild inconvenience for a college grad, but it can take up to 4 times longer for someone in their 70s to heal. Falling and harming ourselves becomes an increasingly large danger the more and more medications you're on, because managing that can get difficult and confusing at times. So today, I would like to help you prevent and maybe navigate through some healthy habits regarding medications. It can be overwhelming at times, and I don't think anyone should feel bad if they're confused about their own meds. It's very complicated. The kind of general structure for this will be, first I'm going to go over some typical types of medications that can contribute to falling. Then I'd like to briefly discuss some drug and drug interactions or drug diet interactions that people may not know about. And then lastly, I'd like to push you guys or encourage you guys to utilize your retail pharmacist. I used to be one before I worked at the hospital, and it's definitely an area of medical knowledge that is not being utilized by the public to the degree it could be. Okay, so let's go into medication classes first. I've kind of whittled it down to 5 major classes that I feel like are the biggest contributors. The first one, and in no particular order, these are all even contributors, I would say. But psychoactives is the first class, and these types of medications generally target the brain, and they help stabilize. Maybe they can help with bipolar disorder, they can help with memory, chemical imbalances, and even depression. These meds have a major side effect of drowsiness, though, which can definitely contribute to a potential fall later in life. Some examples of these are Abilify, amitriptyline, and Lexapro, but there are thousands. So just know, psychoactives are definitely a class that could be a problem. Next will be antihypertensives. That's just a kind of a big word for lowering your blood pressure. These medications lower your blood pressure in a multitude of ways. Some examples are beta blockers and calcium channel blockers and diuretics. You may not know exactly what that means, and that's okay. Just know that when you do take medications to lower your blood pressure, if it goes too low, you can have something called orthostatic hypotension, or just hypotension in general, where you feel lightheaded and can possibly fall. So and most people are on some form of antihypertensive, so that's going to be a big one we're going to pay attention to later. The next class will be diabetic medications. These lower your blood sugar for patients that can't do that themselves in their body, but it's kind of a similar process to blood pressure medications. If you take your glucose or you take your blood sugar pills and it goes too far down, you can get lightheaded again. Some common examples are glipizide, glyburide, and glimepiride. Those all sound very similar, which is why it's kind of confusing. But those are very, very big risk factors for, and any insulin formulation can contribute to falling. Another class will be pain medications, very commonly used, specifically opiates. So brand names like Vicodin or Norco, or meds like morphine, they may substantially help with pain, which is what they're intended for. But some of their side effects are significant sedation or confusion, which has been strongly linked to falls later in life. And the last class that I think personally is kind of one of the more dangerous ones is just antihistamines in general. And I think that's dangerous because they're so readily available to the public in over-the-counter formulations. So any person can go to Target or Walgreens or CVS and just buy any amount of antihistamines they want, and they just use it for whatever it says in the bottle. So that could be heartburn, rashes, nausea, you name it. Antihistamines do a lot for the body. They're a great medication, but I guess they're infamous for anticholinergic side effects, which is just a big word that groups all the side effects in the previous slide together. So things like drowsiness, blurred vision, urinary retention, dry mouth, all of those can contribute to falling because of the way that the antihistamines work in the body. And because they're so prevalent, it would be so easy to just pick one off the counter, take it without knowing how it's going to interact with other medications or your diet, and potentially cause a fall. So those are the big 5: antipsychotics, antihypertensives, opiates, or anti-diabetic medications, and antihistamines. So chances are you may be on some of those. So feel free to totally ask questions about them during the question portion. Next, I'd like to touch on drug interactions that can contribute to falling. Some examples would be something simple like if you're on a blood pressure medication and it's not quite doing its job. Sorry, you're going to hear some phone calls in the background. If it's not quite doing enough for your blood pressure, the doctor may give you a secondary medication. So they have two different ways to lower your blood pressure. And the interaction between the two may make them super effective. And so that would drop your blood pressure as well. Diet can also contribute. Simple things like hydration. Drinking enough water sounds like a very simple task for the day. And normally it is, but if you're someone that's taking a diuretic, and a diuretic basically makes a person use the bathroom more frequently, it lowers their blood volume, which helps lower their blood pressure. But if you don't have enough hydration in your body, if you haven't drank enough water for the day, that diuretic may force your body to lose too much fluid, which will make you lightheaded and fall. So diet and drug interactions can definitely contribute to a fall risk. And something, sometimes when you're older, a broken hip may not seem like a big deal, but it is a significant, potentially life-altering injury. So we really want to do our best efforts to make sure that we are protecting ourselves and have really healthy medication habits. Some good food for thought is if you are like your diet, like I said, talked about with hydration earlier, how something simple as water can impact the outcome of some of your regimens. Another one is just developing good habits in taking your medications. If you're on, one med, it may not be that hard to remember. I just take it at night, one time a day, pretty simple. But chances are you may be on 2 or 3 or 10, and some are once a day, some are twice a day, some are 3 times a day, and it can get very confusing if you've taken it or not. So developing good habits in documenting when you've taken your own tablets, maybe a pill box that have like Monday, Tuesday, Wednesday, Thursday, Friday, you can put your pills in there to know if you've taken them, is a really, really good strategy. And it sounds so simple, but it is so effective. I can't even tell you how many times a patient has called and said, hey, my blood sugar is way lower than it used to be. What's happening? And through questions and learning about their habits, it turns out they took one in the morning, they forgot, took another one at lunch, and now they're double dose for the day. And that happens a lot. So just documenting something simple of when you're taking your medications can truthfully save your life. I know that sounds like a large jump, but I really think it's that important and it's that simple of a change. And kind of in a nutshell, the last thing I would like to talk about is your retail pharmacists. They are readily available in any retail chain. So Save Mart, Walmart, CVS, Target, any of those, Costco, any place that has a pharmacy that you pick up your meds at, you can ask that pharmacist for free any medical question you need. And they are licensed and very educated. I used to work retail. I used to work for CVS. And the best part of the job, and I mean this, the best part of the job was when someone had a real question, pulled me aside, I go to the consultation area and genuinely talk to them with a real conversation, either showing them how to use their medications, telling them what to expect. That's how you can really impact lives in a positive way. And for some reason, I think it can be uncomfortable to ask for the pharmacist, or maybe you have to wait a couple minutes because they're doing something else. So people tend to not do that. The public tends to underutilize this free resource. But in reality, it should be your first stop shop for any medication knowledge. Any retail pharmacist can answer those questions. And if they can't, they have plenty of resources to find information for you. It's very important to utilize them. And I think that the public can do a much better job at that. And so that is pretty much in a nutshell what I had to say today, but I would love to answer some questions if you have any.
Awesome. Thank you, Jared.
No problem.
And I love the healthy medication management. We got to make sure that we're having healthy medication management. I like that. So at this time, I'd like to open the floor up for any questions that you might have for Jared regarding anything that he discussed or anything that you have in regards to medication management or side effects. You can pop those into the chat. I do have a couple of questions for you, Jared.
Great.
So you mentioned reaching out to the pharmacist if you want to talk about your medications. Do you have any tips or Like, do people need to make appointments, or what are some tips to making that conversation happen?
I'll just be real with you guys. Retail pharmacy is very busy. Everyone is constantly running around. People show up to the retail pharmacy because they're not feeling good. They need to pick up meds. So it is a chaotic environment, and it could be definitely off-putting for the audience looking in. But I think the biggest strategy is to be patient. The pharmacist wants to help, but they have probably 1,000 tasks to do. So if they don't immediately come to you, it doesn't mean they don't want to come to you. It just means that they will get there eventually. And once you get the pharmacist in your site during a conversation, a lot of patients will just nod as like whatever I'm saying, they just want to nod and kind of be on their way. But those are critical moments. If you have questions and I'm saying something, or the pharmacist is saying something that you don't fully understand, take a pause and ask them to reiterate in a different way, or double down on your question, because those are the moments that it's about. So I would say patience and not leaving that conversation unsure of the answer.
Perfect. So we have another question in the, we have 2 questions in the chat.
Great.
What time of day should I take vitamin B12? Along with that question, can it interfere with your sleep? B12.
B12, luckily, is a water-soluble vitamin. There's 2 different formulations that are common. Usually there's tablets, or there's also intramuscular injections. Timing of the day is not that critical for a B vitamin. Luckily, they're water-soluble, meaning any extra B vitamin that your body does not use will be excreted into your urine. So it's very unlikely or impossible to overdose on vitamin B. There aren't that many interactions. And because you can take such high doses of it safely, I don't think that's one you have to worry about. My one recommendation would be, if you take it in the morning, take it every day in the morning. Be consistent with the time that you take it to give your body the optimal amount of time to absorb that vitamin B.
Perfect. Thank you. This next question, maybe you have some other resources that I don't in coming slides, but are there medication disposal areas available in Modesto?
In Modesto, I believe there are some that are available. I don't have them off the top of my head, but in Los Banos and any area, one underutilized disposal tactic is to bring as long as it's not an egregious amount, if it's just a vial or 2, you can bring them to your local fire station or police departments, and they will remove it for you. What I would do, I would just take off any of your health information, like the label on the bottle, essentially. Take that off prior to dropping those off, because they can take the meds and dispose of them for free.
Perfect. And I have some further information for that question, so hang on with that question. Another question, speaking of vitamins, are there any vitamins that older adults do you recommend that they look into or talk to their doctor about?
I would say, I think any just a multivitamin, is that what they're asking for? I think a general purpose multivitamin is always a good answer. There are formulations that have more calcium or more vitamin A for eye health, so they can get more specific to your specific ailments. But anyone, even young people, can benefit from just a one tablet a day multivitamin. I don't think that any brand in particular is better. Centrum is probably one of the most popular, but any generic has almost identical properties. So I would recommend any of them. Just be consistent and definitely take it.
And then are there any other specific, like I've heard vitamin D, are there any other vitamins that older adults should really pay attention to?
It's hard to say that every older adult should take something, because vitamin D is not water soluble. So chances are the elderly do have, I guess, they lose bone density. So taking vitamin D with calcium as a combo is the best way to get more vitamin D into the body. However, if that's not being monitored by your doctor, it is possible to take too much vitamin D. So I don't want to make a blanket statement by saying, everyone should be taking vitamin D, but I think that as long as you have a close relationship with your doctor and things are being monitored appropriately, vitamin D would be definitely a good thing to take, I think, on average.
Perfect. Another question into the chat. So you discussed diet. So we had a question here. Does black licorice or garlic typically interfere with medications?
They can. So this is actually a good point. So black licorice and garlic, ginkgo biloba, ginseng, and grapefruit juice, or grapefruit, real grapefruit, not grapefruit flavor, but grapefruit, actual fruits, um, are are decently effective liver inhibitors. Meaning, and the liver is an organ in the body that will help break down medications and excrete them. So once you've taken a medication, it does its job, you feel better. You don't want that medication staying around forever. So your liver will generally break that down and take it out of the body. But if, for example, if you've had like a gallon, not that anyone would do this, but if you've had a gallon of grapefruit juice in the morning, your liver is not working that well. It's being hindered in its effect. So the medication that you would take will have a greater effect for a longer time because of your diet there. The grapefruit juice will be inhibiting your liver, which will not be excreting the med as fast as possible. So that's one way that it could definitely impact. So, oh, sorry, and this is black licorice, and what was the other one?
Garlic.
Garlic. Those are both inhibitors as well, just not to the degree of grapefruit.
Okay. And then there are a lot of cost-effective commercials regarding medication. If my insurance doesn't cover it, do you know, what is the benefit of those cost-effective?
So that's a great question also. And let me see how to word this appropriately. So when your insurance does not cover a medication, it's probably going to be very expensive. Now, there are programs at each individual retail chain. I used to work for CVS, so I know CVS has a house discount card that they'll apply to your account if you don't have, or if it's not covered by your insurance. And that will take off a certain amount of price depending on the med. At that cost, though, you were kind of like selling your data, like the data that you use for that discount card will be, that's what the company as a discount card gets. They get your data and they give you a discount on your meds. And it definitely works. The most popular one is GoodRx, and they have a website. If you go to goodrx.com and you type in your medication and type in the strength and how much tablets you need, it'll give you the cheapest price at the cheapest retail. And it'll tell you all of them: CVS, Walgreens, Walmart. It'll give you all the prices it would be, and you can just go to the cheapest one. And that's a really good resource if you're on a lot of meds that aren't covered. And I've seen GoodRx drop the cost by 80% before. Significant.
That is great information to know. Okay, if you have any other questions, you can pop those into the chat in the next couple of minutes while we still have Jared. Moving forward a little bit. So just a couple of takeaways that we really want to mention. So as Jared mentioned, organizing your medications, making sure that you know what you are taking, when you're taking it, reading your labels and talking to your doctor or pharmacist regarding especially new medications. And then writing out your prescriptions and having them on hand in your purse or your wallet. If you were out and something happened, at least you'd know what you were taking, and first responders could help you maybe a little bit easier. Again, as always, we encourage you to talk with your doctor or pharmacist regarding specific questions for your health and your medication. So please take these questions to your doctor if you have further questions so that they can help you personally. As Jared mentioned, so yes, there is safe disposal out there in different cities and different counties, specifically one coming up in Modesto. It is going to be on the 29th. Drop the Drugs. They dispose of prescription medications. If you're not able to make it to this event, please note that they will accept sharps. If you're not able to make it to this event, you can also call the number there on the bottom of the screen so that you can further find out some safe ways to dispose of medications, just so you can get them out of your home and keep those around you safe. Also, alongside, we haven't talked too much about this, but alongside managing those medications, being aware of those side effects, we want to make sure that we're having good nutrition and we're staying active and healthy. So Healthy Aging Association, who is helping to put on this Healthy Aging and Fall Prevention Summit, has some ways that you can do that, whether that's you're looking for fitness. We offer strength training, Tai Chi, line dancing, our walking challenges. We also offer some ways to help with fall prevention. So as Jared mentioned, there are some ways that you can help prevent falls, managing those medications. Some further things that you could do is the Dignity at Home program helps to keep your home environment safe. And the A Matter of Balance program helps you to discuss concerns that you have about falls and how you can change those habits to make sure that you are decreasing your chances of having a fall. We also have a couple of nutrition classes that we do. Our Go Green for Seniors Green Bag program is a once-a-month fruit and vegetable distribution that happens throughout Stanislaus County. And we also offer a Food Smarts class regarding how to make healthy meals and how to incorporate more fruits and vegetables into our diet. So those are a couple of options on local programs that you can take advantage of. Before we go, I do have one more question for you, Jared. It's here in the chat, and it says, I recently had spinal decompression and was told to stop ibuprofen for 1 year, but they did not tell me why. Do you know why they might have recommended this?
So ibuprofen as a class is something, it's part of an NSAID class, and they work on 3 components. They're antipyretics, so they help with fever. They help with pain, but the biggest reason to use ibuprofen or naproxen, which is Aleve, is for the inflammation. And so if she had spinal decompression and was constantly on Motrin, which is ibuprofen, the tissue in her spine may have been artificially suppressed in terms of inflammation because it's suppressing that inflammation. So the decompression may aggravate the body a little bit. And so for this next year, they want to see what the actual inflammation levels are in the body. I can't say that I've seen that recommendation very commonly, but that would be my best guess on why.
Thank you so much, Jared.
No
So
problem.
that is all we have for you today. Thank you for joining us on our virtual session with Jared Cortopassi, a pharmacist with Sutter Health. And we hope to see you tomorrow for our session on falls and nutrition. So have a wonderful day, everybody. Thank you so much.
Thank you very much, guys.
Take care.